pain, stiffness, swelling, and limited to virtually no movement. In case you haven't guessed, I'm talking about arthritis. And while it's a disease that is not fully preventable, there are several treatments that can help.
According to the Arthritis Foundation, over 40 million Americans suffer from at least one form of arthritis, and more than 300,000 of those are children. Amongst over 100 forms of arthritis, the most common are osteoarthritis, rheumatoid arthritis, fibromyalgia, and juvenile arthritis.
If a patient thinks that they may have arthritis, it's important to get in and get evaluated, because if it's an inflammatory arthritis, you want to get on medicines for it. If it's just degenerative arthritis, you may want to get into physical therapy and get specific treatment for that joint, all of which can improve your quality of life.
Osteoarthritis is the most commonly found form of arthritis, affecting over 25 million Americans. It has the potential to hinder your ability to do simple day-to-day activities, including work.
What happens in osteoarthritis is the articular cartilage, the white coating on the end of the bone, gets worn off. And if that gets worn off on both sides of the joint, you then have bone on bone. But basically, motion is lost, pain is increased, and patients' ability to function in terms of their work or daily activities is diminished, and frequently it starts to interfere with sleep patterns at night and other things.
There are two types of osteoarthritis, primary and secondary. Primary osteoarthritis can be linked to general aging and is mostly found in older men and women. Secondary osteoarthritis can be found at a much younger age and typically occurs 10 or more years after a specific cause, such as an injury or obesity.
In terms of osteoarthritis, there are no real cures of the disease. As it gets more aggressive, we may want to try and calm down the inflammation in the joint with either a cortisone shot or hyaluronic acid injections, which is a substance that actually lubricates the joint more. Ultimately, though, if it gets to be bone on bone and the range of motion decreases and the pain increases, and in that setting, usually that's when we proceed to a joint replacement of some sort.
Pain-relieving medication may be helpful, but self-management strategies can do much more to help someone suffering from osteoarthritis. These strategies might include a healthier diet and ample amount of exercise. You should also study the disease and regularly discuss it with family and healthcare professionals as well.
Rheumatoid arthritis is the second most common form of arthritis, and it's the most severe. It can affect more than just your bones and cartilage. It can attack the body's organs, like the eyes, lungs, and heart as well.
So rheumatoid disease is a chronic autoimmune phenomenon, and the antibodies actually attack the joint and erode the articular cartilage. Fluid builds up, the lining gets extremely inflamed and boggy, and it just is a much more aggressive disease than degenerative disease.
While some people diagnosed with rheumatoid arthritis may have fortunate periods of remission from the pain and inflammation, others can worsen over time. Other symptoms might include stiffness, swelling, redness of the skin, fatigue, weight loss, and low-grade fever.
As far as the treatment for rheumatoid disease, it's generally medical treatment to begin with, and there's two families of medications that are used. One is for anti-inflammatory effect. You're just trying to calm down the inflammation of the joint. Those are standard anti-inflammatories that are prescribed. There are more powerful medications that actually lead to the remission of the rheumatoid disease, and those are akin to some of the anti-cancer medications where they actually attack the autoimmune cells.
Studies show that early diagnosis combined with intense treatment is the most effective way to prevent joint destruction. Similar to osteoarthritis, you should engage in physical activity as much as possible to strengthen muscles and bones. This should include several variations of stretching to help with joint flexibility and support. Another form of arthritis commonly found amongst women between the ages of 20 and 50 is fibromyalgia. This type might not be exactly what you think of when you hear the term arthritis.
Fibromyalgia is a different variant of disease, and rather than affecting the joints, it actually affects the muscles and the tendons and the fascia. Patients get very hypersensitive to touch in these areas.
Some symptoms of fibromyalgia might include fatigue, sleep problems, headaches, depression, and even anxiety. These symptoms can range from mild to severe depending on the person.
Treatment for fibromyalgia is similar to other arthritis with anti-inflammatories and pain medication, but it's a lot more involvement of physical therapy modalities and just physical activity. The pressure points respond to massage, yoga, gentle manipulation and stretching. It's important to keep the tissues moving with fibromyalgia.
One of the most common misconceptions about arthritis is that it only affects older adults. The truth is, juvenile arthritis is one of the most common childhood diseases in the United States.
Juvenile arthritis is the term we give to any patient that's got arthritic condition under 16 years old. Juvenile disease can come, particularly rheumatoid disease, can come in several varieties. One can be extremely aggressive and affect the whole body, and there are other types of juvenile rheumatoid disease that affect just one or two joints. The treatment is very similar to any type of arthritis. You try and calm down the pain and also calm down the inflammation. If the patient has the fulminant variety, which really affects the whole body in an autoimmune phenomenon, then a rheumatologist is going to want to bring in some of those more potent medications to calm it down.
Coping with arthritis can be a difficult task for anyone, let alone a child. It's very important for children to know that other kids are going through the same thing. Talk to your children and encourage them to remain active or even join support groups.
Adults with arthritis can also seek support. It's important to remember that you're not alone. With the help of your doctor on pain management and living a healthy lifestyle, arthritis doesn't have to be debilitating.